For my movie review, I chose American Sniper, and my chosen patient is Chris Kyle, a U.S. Navy SEAL and notable sniper during 4 deployments to Iraq. I enjoyed this movie, and I thought it showed disturbing scenes that those who served had to encounter on a day-to-day basis. It pulled at your heartstrings and showed both war and the impact it had on personal life with his wife and children. I think it accurately depicted the mental health condition of PTSD and showed how witnessing a traumatic event can leave devastating effects. This movie displays the overall goal of mental health nursing and highlights how hard it is for veterans to admit they have a problem and deny medical treatment until it goes too far. And it stresses the importance of seeking treatment for PTSD and talking about what happened at war. This movie highlighted the DSM-5 diagnosis of PTSD related to exposure of war, death, and Chris having to kill over 160 people. He had intense and prolonged psychological distress, recurrent, involuntary, and intrusive distressing memories of the traumatic event, and reactions to internal and external cues of dog barking, hearing a drill sound, and hearing a baby cry. He started to avoid his family and detach himself from his wife without being able to experience happiness, satisfaction, or love in his family life. He exhibited irritable behavior and angry outbursts towards his dog due to it barking, and problems with concentration from staring blankly at a TV screen. The story does not specifically mention the medications Chris used to treat his PTSD. However, in the beginning of the film, he denies medical treatment despite his blood pressure being 170/110, and he is not talking about what's happening during war and acting like everything is fine. However, later in the movie, it shows him attending support groups and therapy to help process these emotions that happened at war, and these support groups changed him where he's able to inspire and relate to others and helps him process his emotions in a healthy manner. He was then inspired to write a book where he was able to face the trauma he encountered and write about how it made him feel. He also co-launched a non-for-profit where he was able to get supplies to wounded veterans. The triggers about PTSD vary dependent on the trauma and the PTSD that's encountered, and the symptoms may be delayed where the onset does not occur for at least 6 months after the event. And there's various symptoms that can occur other than the ones that Chris encountered. These symptoms include nightmares, trouble sleeping, flashbacks, loss of appetite, drug and alcohol use, and suicidal thoughts, which suicidal thoughts is shown in the film when he sees his brother after a long period of time, and his brother's displaying signs of depression and suicide, and he states, blank this place. Some medication that are used for PTSD include antidepressants such as SSRIs and SNRIs, which can reduce the PTSD symptoms by regulating those neurotransmitters. However, they do take 4 to 6 weeks to show effects. Some therapies include EMDR therapy, which focus on the trauma memory while experiencing bilateral stimulation through usually the eyes to reduce the vividness and emotion with the trauma. And cognitive-based therapy and cognitive processing therapy are both used to change the patterns of behaviors in regards to the trauma. And prolonged exposure can also be used to gradually approach the trauma-related memories and discover that they're not as dangerous as you perceive them to be. Through this movie, I learned that each patient's experience with PTSD is extremely different and can affect patients in different ways. The symptoms, severity, and onset can vary over time for each individual patient, and also the importance to talk about PTSD and identify the triggers which can lead to anxiety and fear. 2 goals that I created for Chris is one, that each week Chris will attend and participate in veteran PTSD support groups bi-weekly, because this showed immense improvement in his behavior in the movie, and I think he should stick with that. And also within a year, Chris will openly discuss fear and what is invoking the sense of fear and apply effective coping skills to resume normal life activities, which he was getting to at the end of the movie, but I would like to see him progress in those skills. The primary nursing diagnosis I came up with is ineffective coping related to perceived fear after serving in war, as evidenced by inappropriate defense mechanisms, as seen in the movie, and changes in personality and behavior towards his family. I think that this is an appropriate nursing diagnosis because he had a really hard time coping with what happened in Iraq and processing those emotions of war and having to kill others. And lastly, some nursing interventions that I came up with was encouraging therapeutic communication and acknowledging the patient's feelings to show understanding so they can open up in a supportive environment and grow. And also encouraging positive self-talk and self-care for one, and education on the risk for self-destructive habits such as self-medicating with alcohol and drugs, because this is very common with those with PTSD. Also educating on the importance of self-care activities such as exercising, proper sleep, eating healthy, and taking care of themselves. Another education piece is relaxation techniques such as deep breathing, yoga, and meditation, and observing the signs of fear and triggers of the PTSD symptoms, and then using those coping strategies to relieve these symptoms and have a support system that one can access if these symptoms occur. And lastly, refer to a therapist, counselor, or support group for further help with this diagnosis. Thanks for watching.